Here is a tumor of a bone. I think you could recognize the fact that this is a bone. I think you could see yellowish, kind of fatty marrow here. I think you could see the cortical bone here and here. And I think you could see medullary or spongy or trabecular or spicular bone, whatever you want to call it. Note that the bone itself is a little bit widened in this area due to the fact that there appears to be sort of, in fact, more than sort of, a tumor within this bone. This tumor is called an osteoid osteoma. It is a tumor of generally teenagers and young adults. It occurs more likely in the lower extremities. It's a benign tumor. If it was not a benign tumor, it wouldn't have the name osteoma. It would be an osteosarcoma. In almost every osteoid osteoma, which this is, you see a central portion, like you see here, which is called a nidus, N-I-D-U-S, meaning this is the seed upon which the tumor grew. This is the nidus of the osteoid osteoma. And if you look carefully, the bone tissue and spicules within the osteoma are not terribly different from the so-called normal surrounding bone spicules, except they are a little thinner and they may have a little more fibrous tissue rather than fat. Also notice that there's a lot of blood vessels within this fibrous tissue as well. However, the spicules themselves are rimmed by nice-looking osteoblasts here, and living within them, within the lacunae, are the osteocytes. Notice that the fibrous tissue looks sort of nice and regular. Here's a little blood vessel. And that's not entirely different from the normal bone surrounding it, in which we see osteocytes here. Oh, perhaps some osteoblasts along here. Perhaps there, and a looser, more fatty marrow in between. I think I might have another picture for you here. This is another picture of an osteoid osteoma, in which you could, whoops, wrong one, in which you could see probably nothing because the computer doesn't want to show it. But if you look up here, you can see a little nidus there too. Thank you very much.